Hello, Dr. Anthony Giacalone here from Atlantic Coast Chiropractic, bringing you today's Time to Think. When should I use heat? When should I use ice? A couple of days ago, I had a patient come in, was working over the weekend, doing gardening work, yard work around the house and stuff, came in, all of a sudden had sharp pains. Obviously that patient didn't look at my last month's blog, How to Avoid Injury this spring, but came in, told me that when he came into the house and wasn't feeling well, put heat on his back, felt good temporarily. A couple hours later, woke up and couldn't move. Came into my office the next day, did an evaluation on him, worked him up, treated him, discharged him, and when he left, I told him I wanted him to use ice because the area was inflamed. Gave him some instructions. We followed up this morning. The patient's doing 90% better. Got me thinking, this patient really would have not had a problem had he not used heat after his acute injury over the weekend. But he didn't know what to do. So for today's Time to Think, I wanted to inform us a little bit about when should we use heat, when should we use ice. To start with, we need to know what these two modalities do. Ice, or cryotherapy, is a vasoconstrictor. And what that means is it constricts blood vessels and prevents blood from coming to the area. It gets rid of inflammation, in short. So if we have a swollen ankle, we can see that clear as day. We know we need to throw ice on that. The problem is, sometimes it's hard to see an elbow, hard to see a shoulder or our back or our neck. Sometimes the inflammation is not superficial, sometimes the inflammation is deep, so we don't know if the area is inflamed or if we should use ice. Heat, on the other hand, or thermal therapy, basically is a vasodilator. It opens up blood vessels and allows heat to come to the area. This is really good for strains of muscles, chronic aches, things of that nature. So, question becomes, what should I do? Without looking at the area itself, it's kind of hard to decide, but there are some general guidelines that we can use to dictate what we need to do. If it is an acute injury and it just happened within a day or two, you did something, or not even sure if you did anything, but a pain just started, you should usually start with ice. All right, ice we usually want to use for about 48 hours to 72 hours, 2 to 3 days. When we're applying ice, we should apply the area for about 15 to 20 minutes. Never put an ice pack or the frozen peas directly on the skin. You always want something, whether it's a paper towel or a shirt you put between the skin and the area that you're being treated of the ice pack there. And we do that for 15 to 20 minutes. In general, we want to do this at least 3 times in a day. If the area is really acute or inflamed, you should do it 15 minutes every hour. So you put the ice pack on, you do that for about 15, 20 minutes, you take it off, an hour later you repeat the process. You do this over the course of 2 or 3 days. If the pain is sharp, in general, that usually means that there's an inflammatory process going on. It could also be a muscle spasm, which the average person is not really going to know, but a general rule of thumb is if it's a new pain, or if there's a sharp pain in the area, or if you're not sure what to do and you want to try something, always start with ice. The reason why we say not to go to heat is because if the area is inflamed and we don't know it's inflamed and we're putting heat on that area, it's like pouring gasoline on a fire. We're basically just having blood rush to the area where we shouldn't have blood rush to the area. It's one of the big things I see in my office here, people coming in and they try to do the right thing and they're putting heat on the area and they made the condition 10 times worse. On the other end, if we just have general achiness, you're waking up in the morning, you're stiff, you did a lot of work throughout the day and you're coming home in the evening and your hip or your back is sore and it's just a mild general ache, that's usually when the hot pack applies. Same type of thing as with the ice pack. I usually recommend no more than 15 to 20 minutes of the heat, and it doesn't matter whether you're using electrical or a heating pad that you put in the microwave or moist heat. 15 to 20 minutes over the area, and you can do that about 3 times a day. If the area is really nagging and it's a constant aching pain, you could do that every day for 1 hour a day as well. Lastly, I want to talk about something called contrasting. Contrasting really helps speed up the healing process. And what this idea is we start with heat to bring blood to the area, and then we use ice to get blood away from the area. We generally do this heat first, then ice. I recommend starting with the hot pack, doing it for about 10 to 15 minutes, then taking it off, and then directly after applying the ice pack, 10 to 15 minutes, then taking the ice pack off. You repeat this cycle 2 to 3 times in a row, and you never really do this more than 2 or 3 times a day. Very good way to help speed up the healing process. So in general, to kind of surmise what I recommend doing, we have a new pain, it's acute, it's sharp, 2 to 3 days you're going to use ice, 15 minutes on, then you take the rest of the hour off and you can repeat that process as much as necessary, at least 3 times a day. After about 2 to 3 times a day, you're going to after about 3 days, then what I recommend doing is switching to the contrast. All right, when we're doing the contrast, you're gonna do 10 to 15 minutes on with the heat, then you take that off, you directly follow with the ice, 10 to 15 minutes with the ice. You repeat this process several times in a row, and you can do that anywhere from 1 time a day to 3 times a day. Do that for about 2 or 3 days, and then from there you can kind of steadily, gradually go into heat, okay? If you are not sure what to do, or after 3 days to 4 days, the pain is not getting better, go see a healthcare professional. Do not let these pains linger. That's where big problems happen. We start compensating, we're not sure what to do. Go see somebody and get evaluated, and they can kind of help you. These modalities with heat and ice works great, but if we're not sure what to do, or the pain is not consistently getting better, that's a sign something is going on, and have it looked at. Lastly, I want to talk about what we should do just with chronic ailments in general, overuse injuries. You're a tennis player, you're a golfer, you get those golfer elbow, you get the shoulder strains. In general, it's always good to warm up the area before. Never do ice and then go out and do activity. Ice is gonna constrict the muscles and tighten them, which is gonna cause more injury. So what I kind of tell people think of is think about those athletes. Before they kind of go out and play a sport, they're warming their bodies up, they're stretching, they're getting the blood loose, they put heat on the area. Then they go and they play that activity. When they're being interviewed after a game, you see a baseball pitcher. What do we always see after the game? They have ice on the shoulder, right? After activity, we use ice. That's going to flush lactic acid out of the area. It's going to flush any inflammation that happens out of the area. And this is a great tool to use for those chronic strains that we have of repetitive injuries. Thanks for watching. I'm Dr. Anthony Giacalone.